So now we're going to test for hip abduction. For this motion, you want to have the patient supine and you want to have them on the opposite side of the table that is being tested so that the lower extremity being tested is supported. You want to make sure that the hip is in 0 degrees of flexion, extension, and rotation. And you want to make sure that the knees are fully extended. So to check to make sure that the hip is in 0 degrees of rotation, you want to palpate for the medial and lateral epicondyle and make sure that the patella is facing anterior. And you want to stabilize the iliac crest. So you want to have your hand on the ASIS and PSIS. And you want to also watch for lateral flexion of the trunk. So you are going to move the leg laterally. And the end range is going to be there because there's a firm end feel, and you'll either feel the pelvis rotating, laterally tilting, or you might see some lateral flexion as well. So you're going to take the goni, and you're going to have the fulcrum at the ASIS of the leg being tested, and you're going to have the proximal arm on the other ASIS. So you're going to have the fulcrum on the ASIS being tested, and then the end of the proximal arm on the contralateral ASIS. And then the distal arm is going to be on the anterior midline of the femur. So there. And you're going to use the patella as a reference. So Katie has 65, which is a little bit above normal range.